Hello, my name is Dr. Afshan Banu Taibu. I am a general practitioner and I have been working for the last 4 years at Maputo Central Hospital at the Pediatrics Emergency Department. Here in Mozambique, there isn't much awareness of RSV infections, so this is a great occasion to share with my fellow clinicians and with the parents. Through the year 2021, we had in total of 34,827 admissions in total. Of this 34,000, 46.7% were due to respiratory tract infections. Unfortunately, we don't have specific statistics for RSV infections because we lack testing materials, but clinically diagnosed 1% of the referred respiratory infections as bronchiolitis. Unfortunately, no. We do have the guidelines and the knowledge of the recent treatments, but unfortunately it isn't available at our hospital, and I believe this must be due to the high treatment costs and availability in Mozambique. It depends on the severity of the case. For mild cases, usually we treat at the hospital with normal saline nebulizers and discharge mostly on the same day. For moderate cases, generally require oxygen therapy and hypertonic saline nebulizer and may get admitted for continuous monitoring and oxygen therapy. For children older than 6 months, in some cases, we associate bronchodilators and corticosteroids. Severe cases, these generally get admitted to our PQ, where they start immediate treatment with bronchodilators, corticosteroid, and other possible conditions such as metabolic acidosis. In Mozambique, we have 4 levels of healthcare. The first one is the basic healthcare center, which provide minimum services. Usually, most of them do not have admission wards, neither nebulizations for this kind of patients. From here, there are general hospitals, which are more developed than the first level, with admission wards and minimum services such as pediatrics, surgical, and maternity wards. Next follows the tertiary hospitals, equipped with the basic to moderate needs for admission and treatments, and quaternary, which is the reference hospital where we work, in this case Maputo Central Hospital, and we receive patients from all of the previous levels whenever there is need for better investigation and treatment. Some might have an easy ongoing experience, as for others not so, due to the lack of transport, for example, the means from getting to one healthcare point to another, and many other factors. Generally, we evaluate and we diagnose bronchiolitis in a child that is under 2 years with the first episode of breathing difficulty, with or without wheezing, with variation on the oxygen saturation, as well as other symptoms such as coughing, trouble feeding, seems irritable or very tired. Most parents, I would say, normally accept the treatment without any hesitation, but some, due to taboos associated to nebulizing treatment, show some initial resistance. But as soon as we explain to them the importance of the treatment and how it is done, they generally accept it. Most of the times we do have the medication needed to treat for bronchiolitis, so it is also accessible for the treatment. Moderate to severe admitted patients usually have follow-up consultations, usually after a month after discharge, and they continue to have follow-up consultations until they are officially discharged. Some do present pulmonary emphysema, and they are observed for a very long time until there is correction so that they do not have long-term effects after discharge. Unfortunately, no. We have mobile brigades that are present in the communities. They are responsible to spread awareness on some of the most common and concerned disease, as well as indicating the community when to go to the hospital. And they do have awareness campaigns for diseases such as malaria, tuberculosis, HIV, but not specifically for RSV, unfortunately. And I believe that if as soon as possible there is a vaccine, we will be able to have a really good campaign. With proper explanation and making sure that the parents understand the need and how it would impact on their children's health, I would say that there will be acceptance and willingness. We haven't noticed any resistance in any vaccination campaign, so I think it wouldn't be the kind of thing happening with RSV. After learning that there have been some setbacks on the RSV vaccines and knowing that the effort on developing new ones haven't stopped, hence the actual study, I'm looking so forward for it, acknowledging that it would reduce the global burden due to the disease, not only in children as well as adults. This infection causes some kind of burden not only to the child but to the parents as well, due to the poor social demographic conditions of major of the population and the access to healthcare. Knowing that the vaccine would help reduce this burden, reduce the admission and mortality rate in low-income countries would be a huge accomplishment. To know that our children would grow healthier with less risk of severe disease would be very rewarding for every single professional healthcare. I appreciate the opportunity and hope the Awareness Week goes very well. Thank you.